So my background is I'm a medical doctor trained at Indiana University School of Medicine. I'm board certified in family medicine. My interest in the oral systemic balance has grown substantially, mainly because it offers an avenue to treat many conditions for which we don't have a good answer. Or I start to think about people wearing appliance with two different categories. One in particular is sleep. If they're having difficulty staying asleep, if they snore at night, if they are waking up not rested, if they are sleeping but not getting good sleep quality. The other group are people who struggle with pain, and the pain can come in a lot of different areas. It may be jaw pain, it may be neck pain, it may be people have chronic headaches, maybe people are pain down into the shoulders. All of those symptoms stem from dysfunction in the airway, and again, by moving the tongue forward, opening up the airway, relaxing the muscles, things start moving in a more coordinated fashion. The body then is able to take care of itself. Ask patients, what is your sleep like? Obvious questions like, do you snore? Does your partner notice you stop breathing? And then sometimes it's less obvious. Do you grind your teeth at night? Do you wake up not feeling rested? Do you wake up fatigued? Are you waking up frequently through the night? Do you wake yourself up coughing or breathing or snorting? Sometimes people are struggling breathing. And then the other question is the other category rather is just with the muscle tension side of things. In terms of treating sleep dysfunction, the oral systemic balance has really offered an avenue for which we were lacking greatly. CPAP is the conventional treatment for sleep apnea. Nowadays, when you bring up sleep apnea, a lot of times the patient says, "Oh, my coworker was treated for that, and I don't want any part of that." And when they learn and understand that there is now a new appliance that's available that's so much easier to wear and so much easier to utilize, the discussion is much easier. Having that tool available to help people with sleep apnea has really broadened what we're able to do with so many conditions. Blood pressure, chronic fatigue, even supporting the immune system requires deep, restful sleep. And until people get that, they just don't get they don't get better, they don't get to optimal health. It's easy to be compliant with this therapy. Patients enjoy it. Spouses enjoy it because they actually start to get some restful sleep, and patients feel better. Not only do they stop snoring, they truly feel better because they're actually getting deep quality sleep. A couple side benefits of oral systemic balance is really comes from the deep quality sleep. I had one patient who had been treated with the appliance for really what was diagnosed as mild sleep apnea. She was sleeping much better, energy level was improving, fatigue was her main complaint, and that was improving. She also said, by the way, on a follow-up visit several months later, "I've lost 20 pounds. What are you giving me to do that?" And I said, "I'm not giving you anything, you're just sleeping better." And one of the side benefits of good sleep is an improved metabolism. One of the side benefits of good sleep is a drop in appetite. To have good weight loss, successful weight loss, you have to be sleeping, and that's why so many programs fail or do not work well long term, is because unless you fix the sleep problem, you aren't going to correct some of the underlying mechanisms to what led to weight gain. Once you fix the sleep issue, you're no longer surprised when people say, "I'm sleeping better, and by the way, I've lost 10 pounds in the past couple of weeks." It's a fundamental part of our health, and getting that deep quality sleep really is a game changer in terms of getting people back to optimal health. The benefits of the oral systemic balance for sleep are pronounced. Where the program excels is oftentimes for people who have struggled with pain, where the conditions really do not relent with standard medications and standard treatments. And a lot of that comes back to opening up the airway, allowing these muscles to relax, whether they're in the jaw, the neck, even the upper chest, which allows for better breathing, allows for the the whole system to relax at that point, and a reduction in pain. Relaxing the muscles that surround the airway is just critical to helping head and neck pain, jaw pain as well. And it's hard to intervene, in my mind, otherwise, knowing what we've seen with the oral systemic balance, because you have to correct that airway. And we're seeing in so many people it's a fundamental part of the problem. We had one case in particular of a girl who had had a trauma in a motor vehicle accident and really struggled with headaches just about every day since the accident, which was several years prior. Again, we start to think about not only the symptom of the headache, but the tension in the neck that she was carrying, and really encouraged her to investigate the appliance, which she did, and had great success. We have a lot of people who get headaches stemming from, say, the jaw. Another area is kind of the back, the top of the neck, the base of the skull. Headaches in the temple area is very common, and a lot of times that has a deep connection with muscle tension. The appliance is a way to intervene, opening the airway, allowing the muscles to relax, and really knocking out the headache. Another area of success, which is not a surprise now, it was a surprise to me in the beginning, was the connection between the airway and anxiety. So many patients come in with generalized anxiety, and they will often say, I really have nothing to be anxious about. It's just been that way. When the airway is compromised, whether it's all the time or maybe more pronounced when the patient is lying down, the body is going to respond to that. It's going to send up the red flags. It's going to alarm the nervous system to say that the airway is compromised. Consciously, we don't get the signal, hey, your airway is compromised, do something. We just get the signal that the body is under stress, which moves us to a state of more anxiety. And as you allow the airway to open up, the muscles relax, and the system moves away from that state of anxiety to a place of relaxation. It's an intervention that really is non-invasive, that is treating a whole lot of problems, from lung issues to neck issues, chronic pain, headaches, even nerve problems. Unfortunately, it's not readily available, but I'm so thrilled to have somebody in my backyard who does such a good job with it.